Hello, my name is Zachary Matthay. I'm a surgery resident working with doctors Rachel Kalka and Lucy Kornblith, trauma surgeons at the University of California, San Francisco. We would like to thank EAST and the Multi-Center Trials Committee for the opportunity to share our proposal entitled The Ultra-Massive Transfusion Study, Defining Outcomes After Ultra-Massive Transfusion in the Modern Era of Balanced and Goal-Directed Resuscitation. Hemorrhage remains a leading driver of early preventable deaths after injury. With the development of massive transfusion protocols and balanced resuscitation strategies, significant advances have been made. However, specifically for patients requiring ultramassive transfusion, mortality remains unacceptably high, ranging from 30 to 70% in the literature. While this is a relatively rare occurrence, we know these patients to be clinically complex, resource-intensive, and to occur across specialties. Prior research has aimed to develop predictive criteria for outcomes and futility, but this has proven challenging. Results have been inconclusive, and these studies have primarily been performed in eras prior to modern balanced and goal-directed resuscitation. Furthermore, only one study has reviewed ultramassive transfusion across specialties, but without granular enough data to perform predictive modeling for several important physiologic and clinical parameters. So there remains a need to better define predictors of outcomes in a modern era and across specialties. We anticipate identifying areas for further optimization of resuscitation strategies to validate or question existing practices and identify specialty differences. Our primary aim is to determine what clinical and physiologic parameters are predictive of outcomes in surgical and medical patients receiving ultramassive transfusion in a modern time period, and our secondary aim is to compare what clinical and physiologic parameters are predictive of outcomes in patients receiving ultramassive transfusion between our proposed historic and modern study periods. Because ultramassive transfusion is a relatively rare occurrence, we plan a multi-center retrospective cohort study. Our primary outcome is mortality, both early and late occurring, while our secondary outcomes are venous thromboembolism, multiple organ failure, and acute respiratory distress syndrome. We will include all patients who receive greater than 20 units of blood transfused in any 24-hour period, including all specialties from 2005 to 2019. Our only exclusion criteria are pediatric patients. Our strategy will be to identify these rare cases through review of blood bank records and other hospital-based registries, depending on each institution's record-keeping practices. Then, data collection will be performed, and REDCap will be used for safe, secure electronic data sharing. The IRB has been approved at UCSF, but will need to be approved at each center. Thank you so much for listening, and thank you again to EAST and the Multi-Center Trials Committee. If you're interested in participating, please do not hesitate to contact us. We look forward to hearing from you.